Shalom and welcome again to Secrets of Meaning, the podcast and TV arm of Jewish Sacred Aging. I'm your host, Rabbi Richard Address. Thank you very, very much for your time and for joining us in what we hope to be a very, very interesting and informative conversation as part of our little series here on health and wellness issues that we confront in our generation. And to help guide us through what can sometimes be maybe sort of like a maze, we welcome to Seekers of Meaning, Meredith Becker, the Chief Operating Officer for Lions Gate Continuing Care Retirement Community. Meredith, how are you? It's nice to see you. Thank you for joining us.
Rabbi, thank you so much for having me.
So this is part of this, as I mentioned to you, a little series that we're trying to do to take a look at some of the issues around health and wellness. You are an expert in guiding us through some of the vocabulary. Let's start with some basics. Define for me the difference between a CCRC where you work, an assisted living, skilled nursing. What's the difference?
Sure. So let's start out with CCRC, which stands for Continuing Care Retirement Community, which means that independent living, assisted living, skilled nursing, and short-term rehab can be found all on one campus. So, for example, a lot of times people may enter at the independent living phase, and as they age in place or their needs change, they may move through the continuum of service that's being offered, where they will move from an independent living apartment to an assisted living apartment, possibly from an assisted living apartment to a skilled nursing, should they need that level of care. Or at the same time, if anybody in any level of care needs what is known as subacute rehab or short-term rehab, both are synonymous, that people could come under their Medicare benefit and receive those rehab services and return back to their original level of care. Or if their original level of care was out in the community, they could return back to their home that they originally came from before their most recent episode. When you are looking at each level of care, independent living is simply exactly that. It's an apartment with services, meaning that there's a lot of social programming. There is oftentimes a dinner meal included. There's an opportunity to most likely get breakfast or lunch at a bistro or a cafe that would be offered. But the people that come there are really in charge of themselves. When you start needing some support, that's when assisted living starts to come into play. Support could be that you need medication reminders. You may need queuing to come to attend programs, to come to meals. You may need help with some of what we call the ADLs, or activities of daily living, which are toileting, dressing, eating, bathing, and transferring. You may need a little bit of help in any of those. Some of those, you may be dependent in one or two of those. But your needs can be met without having to have somebody being right by your side all the time. When you get into skilled nursing or long-term care, you are looking for people at that time that are probably more dependent in the activities of daily living, meaning that they are no longer able to perform a number of those activities of daily living on their own, or need a tremendous amount of support in those areas of activities of daily living. So you can find independent living that stands alone all by itself. You can find assisted living that stands alone all by itself. You can also find nursing care that stands alone all by itself. And reasons why people choose one over another, sometimes it's geographic preference. Sometimes it could be amenities. Sometimes it could be people are not really familiar with what is actually available to them. But there is a nice comfort when you are able to be in a continuum, because you, in theory, know if you need additional support where you're going to get it.
Meredith, the people walking into the CCRC where you work, Could you kind of like give me an estimate of the average age of when people will come into this?
So when Lions Gate, for example, first came to be in 2007, I would say our average age was probably the late 70s. And all of these years later, I would say our average age right now is probably really between 85 and 88.
Wow.
But yeah, we're seeing people live longer. So we're seeing a paradigm shift a little bit as well, is that people are coming in, with different needs than they once had from when we first opened.
So the coming into the independent living, 85 to 88. Wow. Yep. That's a whole sermon in itself, which we're not going to get to. Don't worry about it. But, so I would imagine then the independent living component is much shorter now before people move down through the continuum. Would that be a correct assumption?
Sometimes. But what we see oftentimes is people, they may come in as completely independent. They start to need a little bit of support. They end up hiring a home health aide to help support them. For example, they could hire a home health aide to help prepare some meals, breakfast or lunch, if they didn't go down to the bistro area. They could do laundry for them. They could be driving them to appointments. We do offer bus service, but it is not, a one-on-one, type of situation. So people hire home health aides to provide them, with the help with the ADLs.
So one of the things that always comes up in working with families and couples in our work is what we call the economics of aging, which are changing rapidly, not necessarily, I think, for the better. So there was a 2021 Genworth study, so it's already a couple of years old, that the national average, according to this study, the national average of assisted living, to go into an assisted living room, not CCRC, not independently, but assisted living, was $4,500 a month. Is that, in your experience, in the ballpark, or is it too low, or is it way too high?
I think it's actually, a little low, to be honest.
Low.
So, but I'll tell you why I think that. A lot of times what consumers don't realize is when they are looking at a freestanding assisted living in particular, they may be getting a room and board rate. And then what happens is they add on a level of care. They add on a medication administration charge. They add on, it could be incontinence products, so what you may think at 45 is all inclusive, oftentimes actually is not. So the consumer really needs to do the math and ask the questions, because at least in the state of New Jersey, there is no set requirement how people present their pricing structure. So while I do offer, pricing we don't charge for medication administration, that's wrapped into the level of service. We don't charge for, different types of, sometimes it's if you need a certain amount of medication, you're charged a higher level. We don't do that, but there are competitors that do that. So I think if I had one message to say to people that are in the assisted living marketplace, would be to really understand the fees and the charges before you decide that you're going to X, Y, or Z place.
When I remember when I had to do this with my mom many years ago, it can be overwhelming. So there may be people who will listen to this or watch this that are entering that phase of life where they're going to have to make some of these decisions. Where can somebody go for help to help navigate this system? Because as you said, there's so many little variations and levels of charges and care, and it may not all be regulated from state to state and location to location. I know there are geriatric care managers.
Yep.
Is that where I should go?
You can definitely look into a geriatric care manager. There are some services that just simply help people take them around to look from place to place. So you could hire them and they schedule your appointments. They go with you on the visits and they help guide you as to which location or which community is the best one for you. You also have the option of working with an elder care attorney who oftentimes now offers what I would say full service. So they usually have a social worker or a case manager themselves that will help facilitate the process of finding the right community for you too.
But that and all that could be an additional charge if I go out and hire a case manager from ABC Elder Care. Okay. The
elder care would be for a fee. The geriatric case manager would be for a fee. Sometimes what I'm referring to is a person that takes you around. Oftentimes the community is working fees out with that person, so there's no fee to the consumer, but it is it's purely looking at different options, and taking you around. It's not doing any additional care managing for you. It's just helping with the selection of the community.
So all of this is really, this takes time. And, and I know from our clergy experience, and I'm sure you have the experience that sometimes people wait till the last minute. The crisis happens and they may not be able to do all the due diligence. There are lots of beliefs out there associated with what we call the economics of aging. One of them, you'll tell me if I'm totally out of the ballpark here, is yes, we have to make these decisions, but Dad is 82 and Medicare will cover these expenses. True? False?
False. So how Medicare works is that what I like to tell people is that Medicare does not pay for you to live. Medicare is a benefit that helps you when you're in the hospital. It helps you when you go to see doctors, and it will pay for a portion of subacute rehab or short-term rehab, again, synonymous, after you've had a qualifying 3-midnight stay in a hospital setting. So if people are looking for support for them to pay for their day-to-day living, that comes to be really under the auspices of Medicaid. So keep in mind, Medicare is a federally funded program. Medicaid is funded by the state and the federal government, but it is managed by the state. So, for example, the Medicaid qualifications in the state of New Jersey will differ than the Medicaid qualifications in Pennsylvania. What the program pays for in New Jersey will differ than what it pays for in Pennsylvania if you're speaking about Medicaid. If you don't mind, just for a second, regarding Medicare, people often don't know what type of Medicare plan they have. For example, do they have a traditional Medicare plan where you have a Medicare Part A, Medicare B? You typically have a drug program, Medicare D. Oftentimes you may also have a supplement or a Medigap. That's all, Medigaps, supplements, they're synonymous. They mean the same thing. So that's a traditional model of Medicare. Or a lot of times people now have what is known as Medicare C, or Medicare Choice or Medicare Advantage plan, which is usually not run by the government, and it's usually run by an Aetna, Horizon, Bravo, by a private insurance. And the reason I bring this up is because sometimes people don't understand that Medicare, when you come to a subacute stay, in either scenario, they pay, well, if it's traditional, they'll pay up to, the keywords here are up to 100 days for subacute rehab with the traditional Medicare plan, provided you are still making progress towards a goal. Oftentimes I see people that think they have 100 days and they're just going to be with us for 100 days. And then they will return to whatever living situation that they had come from, or if they need to readjust their living situation and be discharged. But again, it's up to 100 days. When you have a Medicare choice or a Medicare Advantage plan, Medicare HMO, again, all synonymous, oftentimes the insurance company will make the determination as to how long your length of stay in rehab will be. So they look at the metrics, they look at your progress, and they're making a determination as to how long they believe that you need rehabilitative services.
But to be clear, Medicare does not pay for my assisted living room.
No. Assisted living is traditionally a private pay market only. However, in the state of New Jersey, there is a program called it's a Medicaid program where you can apply for assisted living Medicaid.
So on that, just to again clarify, because this is part of the maze, to qualify for Medicaid, again, state by state, but you have to spend down, and there is a look back, if that's the correct terminology, of several years in order to spend. You have to, in other words, if I'm not mistaken, you have to liquidate assets to qualify for Medicaid, so Medicaid can then pick up the cost of that care. Am I correct in that?
Yes, but I'm going to flush it out just a little.
Please flush away.
Which is, so how Medicaid works is that typically someone needs to have no more than $2,000 in assets. There used to be in the state of New Jersey an income limit, but that has been done away with. So for example, and I'm just making this number up, if income limit was $2,000 a month and you made $2,100 a month, you were not eligible for Medicaid. So we had a lot of people, that were really falling in the in-between mark. So what the state of New Jersey now recognizes is something called the Miller Trust, where they can put in a trust any income that is over the income limit goes into this Miller Trust. And once that person passes, the state of New Jersey will take some of that money that's in the Miller Trust, or will take the Miller Trust funds to pay itself back for the care that they have rendered, the cost of the care that they have rendered. People also sometimes misunderstand that they think if they're on Medicaid that they pay nothing. They don't have a contribution. That's also not true. Medicaid will determine how much of your monthly income that you are expected to contribute towards the cost of your care.
And then there may be somebody sitting there and saying, wait a minute, this is all, I may have to face this one day, but I have nothing to worry about because a couple of years ago, I bought long-term care insurance and I don't have a worry in the world. True or false?
False again. And the reason why it's false is because oftentimes I see people that come with policies and they're not really sure what the policy actually covers or not sure what they bought. What people have to understand is every person's policy is their policy. It's an individualized type of insurance, meaning that there is no hard and fast rules as to what they bought and what it covers and what it doesn't. For example, you can buy a long-term care insurance policy that offers help with home health aides, that offers coverage for assisted living, that offers coverage for adult daycare, that offers coverage for skilled nursing. You can buy a policy that just covers one of those areas. You can buy a policy that covers any two of those areas. So everyone, what they purchase is so hyper specific to them. The next phase would be how much a day did they purchase of coverage? Meaning if you purchase, say, for example, $100 a day for a skilled nursing or a long-term care room or a bed, and the actual cost today for that bed is, say, $600, that means that the person still owes $500 a day for that bed. So it's almost like a discount would be, but it's not a coverage, if you will. Also, when people buy these policies, oftentimes there's an elimination period. So people sometimes may have a 30-day elimination, 60-day elimination, or a 90-day elimination.
What is it? What does that mean, elimination period?
Good question. That means that people are not eligible to use their benefits until they have been in a skilled nursing environment. In this example, they haven't been in a skilled nursing environment until 30 days, 60 days, or 90 days. Why people do that is because they're banking that they're coming first on a Medicare stay that will then convert into long-term care. So going back to the example of when people come in for short-term rehab, but they are not eligible or able to go home anymore, and they need the assistance of the skilled nursing, that they'll start counting their days towards their elimination period during that rehab stay.
I've heard it said, I've run into this, that ABC assisted living or so, we have 100 beds, but we only have 5 Medicare beds. Am I misunderstanding that?
Yeah. So
clarify.
Sure. So when nursing homes operate, they can operate either strictly only as private pay, which is not the vast majority at this point in time, or they can operate as Medicare certified beds only, or Medicaid certified beds only. So what they mean is that they may only have X amount of beds that are certified to service Medicaid residents. They may have only a certain amount of beds certified to certify Medicare residents, or they could have duly certified beds. So sometimes it could be referring to how many beds they actually have that have been certified in order to offer a Medicare bed to somebody. So, for example, there are places in our area that strictly do private pay and Medicare only. They don't do any Medicaid or long-term care. They're purely for a short-term or a private pay.
So once again, it behooves a family who entering this to get help, because this can be, to try to do this by yourself, I would imagine, can be overwhelming, and I know extremely frustrating.
It is extremely overwhelming. It's extremely frustrating. And as a point that you mentioned a little bit ago, is that oftentimes people don't do any research at all until there's a crisis. And once you're in a crisis, your emotions are high. It's truly life-changing. And it's hard to make good decisions. One of the best gifts that adults can give to their children is that they make plans or have an idea as to what they want before the crisis actually takes place. And unfortunately, it's not a really sexy thing to do, to go out and look at different communities. It's not a sexy thing to do to plan, well, what if I'm going to do if I need nursing care? Sometimes these topics are a little taboo. But I would encourage people to take the time to give your children the gift that they are absolutely going to have to make for you at some time. And that way they know what your wishes are. The more that you have planned out, the more conversations you have about what you want and where you want it, is only going to lead to success later on.
So this is part of, and this is part of a conversation we have in our work, in the workshops we do on caregiving, that as important as all those documents at the end of life are, equally as important, hearing what you said, is for a family to sit down and develop what we call a care plan. Including this is, in the event of this is where I want to go, and et cetera, et cetera. To the CCRC, like Lions Gate, or in all the communities that we have, is there, if I want to live there, is there a buy-in, or do I have to pay, or is it a month to month, or is it a combination of both? Could you just address that very quickly?
Absolutely. So I'm going to just give you, my reference will be Lions Gate, and knowing that CCRCs generally work in the way that I'm discussing, but each CCRC, depending on the type that they are, so not to get buried in the weeds too much, will have a little variation of what I'm saying, but this is the general principle. Typically, a CCRC has what is called an entrance fee, and that entrance fee applies to the independent living apartment. So, for example, somebody may pay $250,000 to come in. Then they have to decide if it's going to be a 90% refundable contract, a 50%, or a 0. And what that means is after the person lives at Lions Gate, that either 90%, 50%, or none will be refunded to their estate. In addition to the entrance fee, there is a monthly fee, and the monthly fee goes to cover the cost of housekeeping, programs. For us, it's the dinner meal. It could be for local transportation, things along those lines. As people age in place and they need a higher level of care, you're going to pay a difference in the monthly fee. Hence, you're going to pay less in independent living than you would in assisted living. You'll pay less in assisted living than you would in skilled nursing. For residents that come into independent living, there is a little bit of a break for the residents as they move through the continuum of care in what those monthly fees are, but they do pay with us the current market rate for those fees. At the same token, if somebody is to outlive their assets, now keep in mind, when Lions Gate first came to be, we had people coming in 2007 that are 75 years old that are still with us today. We actually have a large number of residents in the state of New Jersey, 100 years age or older. We have 1% of the entire state centenarians that are living here. So there is a chance that you will outlive your assets. You're going to blow away all the actuarial tables. That's when Lions Gate will either help you with depleting your entrance fee to help cover the cost of your living here, or ultimately cover the expense, because that's the commitment that gets made, with the entrance fee. Now, when you go into assisted living at a CCRC, at least how it is here, is that there is no entrance fee, meaning you can enter any part of the continuum at any time. So you don't have to go through independent living and hit each one. You can start at independent living, you can start at assisted living, you can start at nursing, or you can just come for rehab. You don't have to have one or the other. So the area which you start will have a price structure according to that area, if that makes sense.
No, so there's a price structure for every entry point in the process.
Correct. Some have an entrance fee, yes, independent living does, but the rest of the campus does not.
So this has been a fascinating conversation of very, very basic and absolutely important information, not only for our generation, for my kids' generation as well, because I will bet you that the majority of the Gen Xers who are our generation's kids have not even looked at this and are scared to death to even talk about it. That's just a sense. Here's the easiest question. You deal with families all the time, come to see you, various stages of preparation, non-preparation. If they were all lined up here, you could look them straight in the eye. What's the one piece of advice you would give families?
I would tell them to plan ahead. I would tell them to talk openly and honestly about where they want to live, how they want to live. I know this podcast is not directed at advanced directives or living wills, but that's all part of the conversation. It really needs to be an understanding of what is desired, but also what is desired, but what's reality. if I may, the idea that I hear times I promised my mom, my sister, my aunt, whatever, that I would never place them. I would care for them at home. I promised. Please stop promising, because you don't know what the reality is going to be. And honestly, when you come and you tour a community, everyone has their own feel. Everyone has their own atmosphere. There is one out there, I believe, that would be right for you. So the idea of some imagery that is not always flattering towards the senior living industry, there is also plenty more imagery that is. And sometimes the care that is required or needed can't really be handled forever in the home. So
Correct.
Stop making the promise. It just may not be reality.
No, this comes up at every Art of Caregiving workshop we do, and build in exactly that you make that promise at the deli 10 years ago, and now you realize that you can't because the health and safety of your loved one takes precedence. And we go to a passage from Maimonides in the 12th century in one of his writings, which actually lays out the proof text of when it is permissible Jewishly to transfer care to a third party. And it's part of the workshop we do. But the fact that this is our tradition is, to me, fascinating, and can really alleviate a lot of the guilt that people feel and say, in this particular case, what I'm really doing is going to a higher value according to tradition. Meredith Becker, the Chief Operating Officer of Lions Gate CCRC here in Southern New Jersey. Thank you very, very much for this tour de force of the very basics. So thank you, Meredith. You just take care of yourself. Stay safe, stay healthy, and I'll see you on campus, hopefully.
Take care. Thank you very much.
Our pleasure. To all of you, thank you for joining us on today's edition of Seekers of Meaning, the podcast TV arm of Jewish Sacred Aging. If you'd like to make a suggestion for the programs, just email me at rabbiaddress@jewishsacredaging.com. Go visit the website, jewishsacredaging.com. And if you'd like to help support us on the website, there's a very, very conveniently located donate button. Click on that. Just follow the prompts. We appreciate it very, very, very much. If your organization would like to be a sponsor of some of these podcasts, please contact me. We can work something out very, very reasonably. And again, a reminder that Seekers of Meaning is produced at the studios of Lubetkin Media here in beautiful Cherry Hill, New Jersey. And a shout out to our producer, Steve Lubetkin. To all of you, thank you very, very much for joining us on today's edition of Seekers of Meaning, the podcast TV arm of Jewish Sacred Aging. In the meantime, till we meet again, stay safe, everyone. Stay healthy. And most of all, be kind to one another. Todah, shalom.